Good morning, YouTube family and friends. Hope you had a good week. My week was good, but it was tiring. Very stressful at work. It's month in my new position, and I still don't know a lot. They just don't have time to train me on a lot right now, so it's kind of a bits and pieces. I don't like learning new job bits and pieces. It's just yeah. So we'll see how the next month goes. But anyway, today is Saturday, February 1st, 2025. Happy February. Wow, January flew by so fast, so fast. Can't believe we're in February already. And we haven't had hardly any snow where I'm at. I'm on the border of Iowa and Nebraska. And man, we've received less than an inch of snow. Just a few tenths of an inch here or there. Definitely nothing plowable, nothing to shovel. It's just weird, so weird. And the forecast doesn't look like anything's coming anytime soon. Uh, we've been in the 50s this week, if you can believe it. 50s for the end of January. Wow. But I said, I'm not complaining. I'll take it. So we'll see what the rest of winter is like. But yeah, it's just weird, weird. But anyway, this is my week 45 results of being back on Mounjaro while at the same time battling some medical issues. One being autoimmune disease, generalized myasthenia gravis, type 2 diabetic. I have liver cirrhosis that was triggered by non alcoholic fatty liver disease. As a result, I have enlarged spleen, and I also have a small varices in my esophagus from the liver cirrhosis. I also have sleep apnea, severe sleep apnea, as you can see by my CPAP CPAP mask on my bedboard. So yeah, and the medication right now to treat my symptoms of the autoimmune disease is taking prednisone. But we've been winding down on that. It's hard to believe it's been 4 weeks now. Sunday will be the end of the fourth week. We're on a plan to take me off of prednisone, but it's a very slow progressing plan because they don't want to just take me off of prednisone, the steroid instantly because we don't want to trigger my symptoms or trigger myasthenic crisis. So right now, the end of 4 weeks, I was doing on Mondays, Wednesdays, and Fridays the main dose of 20 milligrams. And on Tuesdays, Thursdays, Saturdays, and Sundays, I was taking a reduced dose of 15 milligrams. Uh, it's been all right. I've had some minor flare ups of symptoms, mainly the muscle twitches and spasms. I think I talked about that a little bit last week. It's definitely continuing. It's gotten worse, but it's not horrible. Uh, yeah, it's just weird. My eyelids twitch right here. This is the weird one of the weird ones is it twitches right in this area. This kind of flutters or spasms. It's just so weird when it happens. All different areas on my arms, my legs. Uh, the newer one is so weird. It's on the top of my foot right there. The muscle will spasm right in here. That is the strangest feeling, and that happens almost every day, a few times a day. So that's an increase of symptoms, but it's just minor. It's not major stuff. So, but also I sleep horrible. I'm really, like I said, I've been really stressed at work, and stress can make this generalized myasthenia gravis symptoms worse. So I still lose my balance sometimes when I walk, but that's mainly at night when I'm tired. I walk around the house, get up, I be laying down or sitting down, and I walk. As I'm walking, I can lose my balance. Sometimes I just have to catch myself from stumbling a little bit. So yeah, there's another symptom, but I can't recall right now. So, but yeah, I did message my neurologist yesterday on my chart for my hospital, my doctor's office, and he replied back late to me last night that he agreed with me that I could continue on, but he did say if the symptoms continue to deteriorate or get flare up more, that I need to let him know right away. So, but he's comfortable right now based on what I've told him, that I can proceed to the next phase, which is a 2-week phase where I'll continue on Mondays, Wednesdays, and Fridays, taking my main dose of 20 milligrams. Then on Tuesdays, Thursdays, Saturdays, and Sundays, I'm going to take it down to 12.5 milligrams. So I'm taking it down by 2.5 milligrams on those 4 days, and we'll see how it goes there. That's going to lead me into my vacation, because I fly out on Saturday the 15th for my 6-day cruise out of Port Canaveral, out now. It's near Orlando, Florida, if you're not familiar with that port. So I can't wait. It's on the Carnival Vista. Woohoo! It's going to the Bahamas. It's going to Grand Turk. It's going to Amber Cove. And a new port that I haven't been to is is it Princess Cays or something Cays? One of those. So yeah, it's a 6-day cruise, so I can't wait for that. If you're interested in seeing videos for my cruising, then go ahead and look at my other channel. It's called Cruise with Sean. Yep, and you can follow my cruise videos. So, but anyway, that's all the update I have for you this week. So I'm just going to go ahead and take my blood right now. So I got my handy dandy tester. Let's do the alcohol wipe. Alright, we'll do this finger this week. Get some blood in there. Test strip. I did ask about my shakiness. I asked if it could be because when you have autoimmune disease, it's easy to develop another autoimmune disease. So I asked if it's possible that my shakiness could be maybe MS developing, because I do have MS in the family. So, and maybe it's not a side effect of the autoimmune disease or the prednisone steroid. And he said, well, if continue to go down on the dose of that steroid and the shakiness continues, then we know it's possible something else. So otherwise, it could be just a side effect of the steroid, or it could be a side effect of having autoimmune disease. So we'll see if it continues or not once I get on even a lower dose of the steroid. So 93, a little bit higher from last week. Last week it was 87, but still 93 is awesome. For being a type 2 diabetic, 93 is awesome for fasting blood sugar. So again, Mounjaro is doing, for those of you that watch this video just for the Mounjaro update, Mounjaro definitely works for diabetes control. And that's what it's mainly used for. Yeah, you have positive side effect of weight loss a lot of times, but it's mainly used for blood sugar control for your diabetes. I had great success of losing weight on Mounjaro. I used to be over 300 pounds. I had got all the way down to 210, but then I started to develop symptoms of the myasthenia gravis, autoimmune disease, and it took some months to get diagnosed with it, and I had a lot of weight gain. By the time I was diagnosed with it, I was diagnosed last July, and so by then I had gained back a lot of the weight because I stopped going to the gym. I was tired all the time. I just didn't know what was going on with me. And so that's not on Mounjaro. At least Mounjaro is stopping me from gaining even more weight. So that's a good thing. Speaking of weight, last week I had my first weight loss in like 7 weeks. Last week I lost a pound to get down to 244. I stepped on a scale this week, 244, so no change. I almost marked it as 243 because it was hovering between, because I don't have a digital scale, I just have a scale with a needle. And it was hovering 243, 244. I tried to stand up as straight as I could, and so it stopped wobbling back and forth, and it landed more on the 244 side. So I marked it as a 244 this week for no gain, no loss. I'm okay with that. Again, I didn't go to the gym at all this week. I got to get myself to the gym. It's so hard. A normal person at the end of a workday is tired, but like I said, on Thursday I worked from roughly 7:30 in the morning till 7 o'clock at night, and I worked through my lunch break. So this new position, it's just it's wearing on me. I know I've said this before in prior videos, but I have to really consider my health. I love this new job. Even though I don't know, I haven't learned everything on it. I got so much to be shown and to learn, but I'm already so stressed out. And stress is a major factor in my disease and controlling my symptoms and trying to prevent flare-ups. And yeah, the money and the benefits of this job is awesome, but I have to weigh that versus the effect on my health. It's a tough decision, folks. Hopefully, you never have to be in a decision where you have to consider your health versus keeping a job with good pay and good benefits, and weigh it. It's like pros and cons of keeping that job versus controlling your health. But said, if I leave the job, I lose all those great benefits. I lose my insurance, and with all the medical issues I have, that insurance has to outweigh the effect of. But then again, now if I keep if the stress of the job keeps it to where I'm not getting better or makes it worse, then what's the point of having insurance then? But that's on the autoimmune disease side of things. I also have to consider my liver cirrhosis. Right now my liver is functioning good, but it's been what, almost 6 years since it was diagnosed as liver cirrhosis. After starting off as non-alcoholic fatty liver disease with an enlarged liver, and the fatty liver, having a fatty liver, but it wasn't cirrhosis at that time. And to instantly jump within a very short time to liver cirrhosis, it like skipped a phase. So it went from fatty liver disease, non-alcoholic fatty liver disease, to instantly liver cirrhosis in a short period of time. So I got that as a factor as well. Along as I have an enlarged spleen, I have that small varices in my esophagus. I have to get scans every 6 months. I get an ultrasound to check that liver to see where it's at, to check for signs of cancer or whatnot. Because when you have liver cirrhosis, the scarring on the liver can easily turn into cancer. And I have major cancer on both sides of my family and my family tree. So I have that to contend with. And then every 3 years, I have to get colonoscopy and endoscopy to check the varices in my esophagus, and a colonoscopy because I keep getting polyps, precancerous polyps. The last time there was 5 of them removed, and that was just within 3 years. The time before that was 3, so I went from 3 to 5 within a 3-year span. So quickly, 5 more developed. So I have to keep up on getting those colonoscopies every 3 years now. Because of that, they've developed fast and they're precancerous. So I got that to continue with. Know what happens if it develops even faster, and by the time I get my next scan, it's something cancerous does develop that's not precancerous. No, so I need that good medical insurance that I get from this position. But then again, I said that the stress of the position, I don't. Yeah, it's tough. But anyway, I'm sorry, folks. This was going to be a really quick video, and I got sidetracked to start talking about other things, and voila, we're at 13 and a half minutes already. So my apologies. But anyway, I'm going to end it there. I hope you all had a great weekend, and remember to live life to the fullest, because you just don't know what life is going to throw at you. Yeah, I mean, take a look at the news these days. With the plane crashes and whatnot. You just don't know what life is out of your control sometimes. You just don't know what's going to happen. So live life to the fullest. Enjoy your family. Enjoy your friends. Tell them you love them. And yeah, I'm going to end it there. If you like this video, smash that like button and hit subscribe if you want to be notified of future videos, and turn on your notifications. And check out I haven't posted in a while to my cruise with Sean, but I said I got 5 cruises scheduled this year. I got one in a couple of weeks. And in May, I fly to Sydney, Australia for a 8-day cruise around the islands of Australia. And then I also have a cruise in August. I have a cruise in October, and I have a cruise on Christmas of next year. I'll be on a cruise during Christmas of next year. So check out that channel if you want. You'll see some videos. I'm not a professional video photographer, so my videos like this one here is pretty raw, and you can definitely tell it's an amateur doing them. So, but hopefully you enjoy them and you get something out of them. So, all right, I'll end it there. Have a good one, everyone. Sorry, folks. Yeah, I forgot to take my shot. So I'm going to throw this in at the end. So, all right, again, I'm on 7.5 dose. Remove cap. Turn it to the unlocked position, and you can stick it in your fatty part of your arm, your gut, or the inner part of your thigh. I do my gut. See, I stuck it in there last week, so we'll do this side this week. I just came out of the shower, so I'm nice and clean. So at least 2 inches away from your belly button. So about right here looks good. This is where I usually stick it. I'm going to plump up my fat pocket. And you'll see watch the green plunger go in and out. There you go. Perfect. No drippage, no blood spot. And it's that quick. All right. Have a good one, everyone.